middle of the adhesing stage, so where it would not be able to lift at all. She was about right there. She could force it up with excruciating pain. Worked on her for a little bit. All the fascia issues were in her hip, which is connected to the shoulder through several fascial planes. Did about 3 or 4 injuries in her hip. Raised her arm all the way up, no pain.
So the fascia, what had happened to it?
So that's the $1 million question right there, and one that we basically cannot answer outside of evaluating your movement and guessing.
You think maybe it had become tight? Or?
It becomes restricted. So or the other term that they'll often use in the literature is scar tissue. But it just becomes restricted, densified in the area, so the whole idea of scar tissue, and then it cannot glide anymore freely. And if it can't freely glide, some other structure is going to be compromised because of it. And so the only thing we can do is look at somebody and evaluate them and see how they're moving and kind of come up with an estimation of maybe this caused it, maybe this caused it, maybe it's a component of all these things. Of course, you might have seen here on the news last week, Washington Post, I think is the one that I saw it on. They're talking about the horns that are growing off people's skulls because of the cell phone use.
Yeah.
So the whole idea of that is doing this creates an extra stress back here, causing bone growth. And that always just happens. And so that is an important thing to realize, that our posture does affect us. But how much can we change the posture and whatnot is a story that we have to get into with our patients. And typically when it comes to general exercises, we do give them. But if we need specific ones, we'll probably refer to somebody else who wants to give the specific ones. The biggest thing we say is get out and walk, get out and enjoy nature, get moving, move with whatever you like the most. So if you like basketball, do it. If it's just hiking, do it. Whatever you like, it's going to be better than just sitting on the couch all day long.
Cool, let's take this one. So last one on that category, because we wanted to hit how to increase the size of the jar. Again, we're going to use that comparison the whole night. So we have this jar, water's filling up. Because the first component is you say, hey, I only have this much at the top. Well, what if we can give you a bigger jar? So how do you get a bigger jar? How do you increase that? The first one was food and food choices. Next one was just movement, this idea of even it really is simple exercise. Last one we're going to put in there is breathing and meditation. This has more effect on people's chemistry than I could ever express. The brain hormones that get produced when people take time to do breathing exercises and meditation is phenomenal. They're seeing it more and more and more in terms of the healing process, in terms of what we call serotonin production in the brain, which is your antidepressants, and all those things all come together through those things like breathing exercises. So when people come in and they say, hey, what can I do at home? These are the 3 things that we focus on and how you can do it at home. And we keep it rather simple. I mean, if someone wants to be a marathoner, that's cool. We can walk you through that process. But I would say that for 90% of people, it's just we want to feel better, healthier, like we have energy, we can go do the things we want to do. So those are the basic principles to how do you actually increase the jar. The next component, which becomes maybe a little more important, is how do you remove what is there? How do you remove the water from the jar? So how do you go from the one on the left, or however you want to look at that, all the way back to this one here, right? How do you actually get rid of that stuff? Because if someone has symptoms, this is something I think it's important to realize. So if somebody has symptoms, hey, I have pains, I don't have energy, I have headaches. If you have symptoms, increasing the jar isn't actually going to fix it. Like we mentioned the things earlier, there is a component to foods, which we'll get into in a second, but that's not always going to fix it, because you're not actually getting rid of the past trauma that's still keeping things aggravated. Another thing I always tell people, that if you actually do have pains, and that means you do have a problem, that an injury has not healed the way that it was supposed to heal. We are not supposed to go around with pain all the time. And so a lot of people will come in and say, hey, yep, did this, twisted it really bad, was in a brace or a boot or something for 6 months, went away, doc said it was fine, good to go, but it still hurts me all the time. Or, as opposed to hurting all the time, now it just hurts me every here and there. And it's like, nope, that means that your body's adapting. It didn't actually fix it. We got to figure out how to actually fix it. So these are the lists we're going to go through. So first one again is the physical injury.
All right, jump to it.
Oh, yeah. No, first one is physical injury, which is perfect. So physical injury, And the reason why I start here is I think it is really because it appears to be the most visible. Like, you know, you can actually have someone come in and say, I can't hardly walk, or this hurts, or whatever, or the frozen shoulder. And then by the time you're done, you actually can resolve that or be well on the way of resolving that. The other two, which is going to be, what is it?
Minor type.
Yeah, the emotional and the chemical. We're going to get into that a little bit more too. But so past sports injuries. You'd be amazed. This is what causes people's current physical problems. So people often come into me and say, hey, you know, I just bent down and picked up this pencil and my back went out, and like I have no idea what happened. And the first thing I do is sit down and go, okay, you know, when have you injured it in the past? What were your sports injuries? What were your childhood injuries? Because these will, again, we talked earlier, I always give the example like Leaning Tower of Pisa, right? Like you start to shift your structure even slightly, and if you build upon that, then you're headed more and more in that direction, right? You're headed more and more towards a breaking point. So something shifted your structure somewhere along the way. Something caused those adhesions in the fascia, like something started that process. And by identifying that, it will get us way further into actually correcting and fixing or eliminating the injury. You can get away with covering up the symptoms or the pain pretty easily by, again, if you say, hey, it's my shoulder, right? So you can go in and you can do release mechanisms and things or adjustments and stuff to the shoulder over and over again, and you'll give people a break for a period of time. But if you're going to actually correct that shoulder thing, you have to identify where it's truly coming from. And sometimes that can be the shoulder. It totally can be the shoulder, but you got to identify where that's coming from. And so again, car accidents, whiplash, carpal tunnel, work injuries, exercise-based injuries, stress-based injuries. So how do we do it? So we assess through muscle testing. We go do through fascial releasing, adjusting, we call injury recall techniques, craniosacral work, acupressure points, all those things to identify that. And this is actually the one example I didn't want to give in our presentation tonight, is at this moment to kind of show that change or alterations with some of the physical traumas. So you're totally cool. Mm-hmm. Yeah, cool. Come on up to that table. Well, you even signed the permission to be on film, so I appreciate it. So we asked at the beginning if anyone had kind of any sort of shoulder issue or problem, and you said yes.
Yes, from work. Kind of, the last time I went to a doctor, he said it was like a muscle spasm, but it stays.
Yeah, it sticks around.
Yeah.
I would actually say this is probably where we, in terms of physical injuries, where we maybe shine in a lot more in a lot of places, especially those things where there aren't these major traumas that occurred to it, right? You can shoot even post major traumas, we have to work with a lot of that too. Cool, so actually if you'll turn and lay face up for me, we're gonna do just a couple little things. My intention isn't to do a crazy amount, but is it both shoulders or just this one?
Mainly this one.
Cool, actually let me have you flip around there, that'll work. So what I first want to go through is that assess through muscle testing. We've talked about this in different health talks that we've given over the time, and people keep coming back to like, well, what is that? And that's actually where I got the idea to say, hey, let's just show it a little bit and the basic premise. And so what it is the understanding and knowledge of muscles and how they move and what they're designed to do. It starts just with the basis of understanding each muscle and its divisions of the body and being able to identify how to actually assess it for contraction or activation, and then moving forward from there. And so you go through a whole process. Okay, cool. Push down with that wrist for me, towards the ground. So what we're looking for is how well a muscle can actually activate and hold. Every muscle of the body is designed to be able to hold great amounts of pressure. Push the elbow back behind you. Straight back, sorry, to the wall behind you. That way.
Okay.
Perfect. And you should be able to actually get a push back, a lock, and hold.
If you need to move around to see
There it
it.
goes.
Go
Push
ahead.
back. There you go. And the person on the table can obviously assess it more than people watching it push down back. So you can feel like that, what we call strong there, and activation there, push down towards the ground, versus that, where it just won't actually hold in place. And I'm actually curious about this. One of the first muscles I always look at for something like a shoulder is what we call subscapularis, which is designed to internally rotate the shoulder, push down. And yours is actually within too far.
And just clinical tidbit, one of the things you'll always notice whenever they tend to be weak is the shoulder will end up hiking.
Yeah. Push back. That's what I was going to try to just show it, kind of a, it's hard to see it from up there, but it's the difference between the two sides. So our internal rotation only should be about 90 degrees, and on this side it does. It goes to like there and like stops. You can like probably feel that. It might be hard to actually see. And the shoulder stays down. That's why shoulders become a great demonstration point. This one, if you let it go, just let it release, relax, will actually turn that far, and the shoulder hikes up. And so that immediately actually tells me she does have a muscle that's not actually activating or working, and she's actually gone too far. She's actually released tension or has created too much motion there, and so she does have an actual unstable shoulder, which in most cases is that.
I'll give you a little bit of an idea. Oftentimes when we're talking about these, it's not necessarily that the muscle is broken. A muscle, the way we always teach it, it's a piece of meat receiving a nervous system signal, a nerve signal. So it's being told what to do. In this case, it's being told to underfunction, to be inhibited. We just call it weak for easy way of just talking about it, weak and strong. And so our goal is to find what will cause it to kick on and function. So what he's doing right now is you go in, the subscapularis runs underneath your shoulder blade, right back here. So it's not the most desirable place to get poked and prodded. But he's going in there to rub on the muscle itself.
So the fascia that you mentioned, is that throughout the entire body, on all your muscles?
And your organs.
And it covers every muscle
Oh yeah.
and every organ?
So not want to go too far with it, just kind of show the demonstration. So like she even shows like push down. So even actually just after that simple release of that fascia, push again, she goes, hey, wait, I can actually hold that. And I asked her, can you feel that? Mm-hmm. Yeah, she goes, I can feel that. Other thing to even notice, again, observation-wise, if I let this go again, it's not going, so far down that way. So this is actually what we call normal shoulder rotation. When she was going further, that's actually too much range of motion, and that actually can be a problem as well. Push down as much as normal, and I know that because we kind of compared it to the other side. Cool. Real fast, push back. Cool, because I know push back. There's going to be more going on. So I'm going to do one other release here, and then actually see how that feels when she stands up. And so what's interesting though is by actually identifying these muscles and how they're operating and getting them to activate again, that's actually how you go through like what we call the trauma recall procedures. In terms of a physical trauma, that's how you can actually eliminate these physical traumas because you return the support to the joints and to the bone structure and to the movement patterns, and so your day-to-day life isn't keeping it aggravated. And so oftentimes, as we talked about at the beginning, this is part of the adaptation process. So when the muscle originally got injured, that strain or sprain to the injury will actually prevent the healing process from finishing or occurring. And so these release techniques and the fascia release techniques are a way to get that to actually reactivate, re-kick on that signal so that the body can finish that healing process.
And she's doing an excellent job, just so you know, it does hurt.
Yeah.
It doesn't feel good.
A lot of times she just is like, yeah.
Mm-hmm.
Some people have a really good pain tolerance. If you saw me or Dr. Quinn on the table, we do not.
Yeah. Push back. We work on each other, we're kind of wusses in this whole thing. Push down. Cool. Go ahead and sit up for me. I know it's kind of quick, but can you even feel a difference in that
Yeah,
shoulder component?
yeah, definitely.
Yeah.
It feels really good.
Cool. Thank you so much. I didn't even catch your name.
Abby.
Abby.
Oh.
Cool. Thank you, Abby. And so, and we'll actually find with those muscle testing, and you're testing to see how muscles respond. So the first thing I go to with physical injuries is you're looking at where muscles originate, those kind of things. Eventually, if it doesn't activate through those procedures, you can start looking elsewhere for other connection points, and that's how you actually do it. It's kind of this little bit of a figure out what's going to activate that muscle, and then you're going to go through, in a complete evaluation of that shoulder, I'd actually go through every single muscle of the shoulder to identify that all of them are working properly. And sometimes that will actually send you into, which will be the next category here, sometimes it will actually send you into even emotional traumas, we can identify if there is an emotional component to why that shoulder isn't activating, and then trying to figure out what it is.
To add on to the end of that, again, back to the whole muscle test and the muscle receiving only a nerve signal. Understand that the muscle test to us is a window into the nervous system. It's our way of viewing and seeing what's going on. And so one of the techniques that we use, and it goes along with the whole book, The Body Keeps a Score, is your body literally keeps a score and remembers where these things are. So if I'm working on just somebody who comes in with a musculoskeletal issue, I will use a particular technique. And the technique itself works off of your body's system, which he actually mentioned earlier when a kid touches a hot plate and pulls back. That's called your flexor withdrawal reflex. But when we injure ourselves, your body ends up keeping a score of all these injuries. And so we go one at a time using the muscle test and remove the injuries as they occurred. So it's a pattern, essentially. And that's something that I know because I'm prone to getting headaches. If I just sit there and just rub out painful spots, the only thing it will do is alleviate it for 20 seconds, and most likely the pain will come back and nausea will come with it. But if I will do it through muscle testing, the pain will actually go away. And because I have to hit the points at the precise time that they need it.
Great components too. Which again, we kind of just did a little brief show up on her. I imagine if I had worked on her more, we probably would actually identify some of these. As she even said, this is how when I get stressed, I feel it. I think that you said that in the beginning. And so we didn't actually look for those kind of components to it. But so how do we help emotional injuries? I mentioned kind of this concept in the beginning, but there are techniques out there developed by different doctors. Some of them have really good just research and things behind them, and that we've been kind of exposed to, and some of them are part of what we call applied kinesiology trainings that we do. And some of you might have heard some of these, but I went ahead and put them up there because we can use components of these. So neuroemotional technique is one. That's the idea that you do identify the trauma itself, and there is a bit of a need to kind of talk through and assess what that trauma was and what emotions it actually, what was the pattern that it created in your life. And you do that as you hold varying different points, acupuncture points that have neurologic connections on the body. And they've been able to prove that by just the addition of those particular pressure into certain points on the body, it will make the difference between just talking through it and then going through this procedure of actually holding and applying pressure to these points, and the before and afters on MRIs, and the showing that the way it actually does alter the chemistry of the brain by adding in that component to the procedure of identifying and just talking through specific past traumas. Body code is another one, kind of similar. Injury recall is one that I use a lot for the emotional component of major physical traumas. Again, you're holding varying points and pressure points on the body as you go through that process of what actually occurred, kind of step by step. Emotional freedom technique is one that a lot of my clients seem to be a little more familiar with, which is what we call a tapping. Its origin is really fascinating. It was originally developed by a doctor named Dr. Goodhart, who came to the realization that people could sometimes still have pain in an injured, like an area that was injured, even though all of the components are testing fine. That the structure is solid, that the injury is not there anymore, so why are they still having pain? And he came to the realization that pain in itself is just simply a neurologic signal. And so he used tapping of varying acupuncture points to help release that neurologic signal. Once he went through that procedure, another doctor picked up on it and actually used it to release phobias, because he came to the realization that pain is an emotion just like phobias is an emotion. He released a book called either 5 minute or 10 minute, 5 minute phobia cure. I think it's called the 5 minute phobia cure. Dr. Callahan was his name. And that got quite really big back in the 70s. And it really does work. I've used it on clients many times. I even used it on clients that have fear of driving over bridges, right, with water under them. If you're able to expose them to the actual thing and go through the tapping procedures, you can do it right there in the office. Sometimes if we don't have the thing, like driving over a bridge, you have to have them like really try to get themselves emotionally in that place as you go through these tapping procedures. And it really does kind of release that. The idea is, again, you're trying to release the physiological response to the stressor or to the stimulus. One other one I should have thrown up there, which actually does find its way into that book of The Body Keeps the Score, is what we call EMDR therapy, which is eye movement therapies. That's used very heavily by the doctor that wrote that book, The Body Keeps the Score. Similar concept, when you identify the trauma and actually have people talk through it, you're moving them into different eye positions because you're activating vagal nerve stimulus. And so you're trying to, all these techniques, the idea is that you're trying to kind of rewire the brain so that it has a positive input, or a different input anyways, to that actual stressor that occurred in somebody's life. So you kind of just reroute, right? You're going to go, hey, so as opposed to when this occurs, freak out, it's when this occurs, it's okay.
Touch one thing.
Yeah.
So chronic pain is something that we see all the time. That's why we have fibromyalgia up there and other things. There's a really good doctor who's the lead researcher in pain out of Australia. He talked about this. I don't know if you've ever heard of the term central sensitization. I have a problem speaking today. But it's the idea where your nervous system becomes sensitized, and thus you are overwhelmed with pain. Every little stimulus just causes pain, and you end up with this chronic back pain, whatever it ends up being. Maybe it's your knee, whatever. He talked about it in the sense of your body being overprotected, and I really liked that idea. And he gave an illustration. You can actually watch him on YouTube talking about this, but since he lives in Australia has poisonous everything, and he was walking out in the bush one day and got bit by an eastern brown, which is one of the most deadly snakes on the planet. Excruciating pain, dealt with it for a long time, and then a year later, after he recovered, he's out in the bush walking again. Same pain happens, and he's like, oh no, I got bit again. Looks down, it's a stick. A stick went by and scraped his leg. That's all it was. But his mind remembered, hey, you're in the bush, you're in the same area, same circumstance that caused the initial injury. Let me send that same signal, but in an overprotective way. So it was excruciating pain. But as soon as he realized what it went away. It gave him this idea that we are in this overprotective mode and we have to release that. And that's where these components, these techniques come in. We have this wonderful scientific understanding of what's going on, but a lot of us don't know how to treat it. And that's what we're talking about, is how to actually release these things.
Yeah, actually, yeah, perfect. That's actually perfect. So then, flower remedies is another one I threw up there. I like using these a lot. Traditionally, these things were called bot flower remedies. There's a current company that I use more called Floralive. They're actually in the Nashville area, Tennessee, and they make a phenomenal product. And it's a similar concept. So back in the 20s, there was a doctor named Dr. Bach who came to the realization. It was a German doctor. He had a big a hospital there. And people would come from all over to get treated by him, and he loved flowers. And so Dr. Bach himself had just an array of flowers out in the areas and outside. And he would notice that certain people that spent more time around these flowers seemed to actually recover and do better. And so he started looking into this and came to the realization that they create pretty much just little teas or tinctures out of different flowers, and that specific flowers do help calm specific emotions. And so you're able to use those as a calming effect to specific emotions. Anxiety is one that I probably use this the most on, because again, we have certain procedures in the office, which is fantastic, like the tapping, like those things, and it starts, for some people, like one session will do it. For others, we have to kind of replace that stimulus over and over and over again. And so giving people something they can go home with, and anytime you start feeling anxious, do this, the flower water, starts creating on a daily basis that retraining of how you're reacting to those particular stimuluses. So it just depends on difficulty of the case. I put it up there, Braverman test. That's one thing I was going to bring and kind of show. We did a Facebook Live on this a couple weeks back. It's a great little assessment. It's all about brain chemistry and where your brain chemistry is. And it was created by a doctor named Dr. Eric Braverman. It's a huge questionnaire. It's about 8 pages of true false. Then you get a whole in category that gives you certain ideas of kind of where you should be versus where you are now. And it breaks down dopamine, acetylcholine, GABA, and serotonin, and where your levels are. And it's something that anytime anyone come in that we're kind of looking at and realize this is a lot of kind of those more psychological type things going on, I typically have them run that test because it gives me a good before and after as well as we go through different treatments, and also can pinpoint some of the nutritional deficiencies that can occur, which is kind of the other two components even in the emotional injury. So we want to make sure we assess through muscle testing. Hormone imbalances can definitely be a part of what can cause an overreaction to certain things. And assessing through blood work, especially things like vitamin D and inflammatory factors, can definitely play a role in it as well.
Since we're going to hit all the inflammatory factors right now.
Yeah, right now.
So the big five. Now we're going to head into something that we treat on every single person who comes in. It doesn't matter if you're coming in for trauma or whatever, has a role in all of this. So the big five: food sensitivities, infections, heavy metals, environmental toxins, and then the last one is stress in general, whether it's physical, emotional, whatever. So food sensitivities. More than likely, everyone in here probably has a food sensitivity of some sort, whether it's a long-term or a short-term. Gluten, dairy, corn, I mean, I think a lot of us have heard these sensitivities. They're very common. Sometimes I've had a few patients here recently who've had 6 or 7 of them, and it's difficult, but they have to be removed until we get better. One of the more common ones that we see, particularly with trauma, or 2 of the more common ones, are methylxanthines, which is caffeine and its derivatives, and solanine, which is your nightshade vegetables. It's actually a chemical within the nightshade vegetables. So peppers, tomatoes, potatoes, and so on. Solanine in particular has a very, very long half-life. So if you ate, let's say, a couple peppers today, it could take up to 2 or 3, maybe even 6 months for it to completely be cleared from your body. So somebody who's dealing with chronic pain caused by solanine, it could take 6 months before we may even see any little bit of a change. Hopefully before then, because there's certain herbs and things like that will help to clear it out.
But most of the time before then.
Yes,
Yeah.
I don't think I've seen 6 months.
I don't think I've seen 6
I've
months.
seen a couple of months, but it's usually because they didn't know that there was nightshades in something they were eating. Caffeine is one of the ones that is one that's overlooked because dark chocolate is healthy for you, but unfortunately it can cause a problem too. Infections, huge, huge problem, and it can fly under the radar because your blood test won't actually show it. The most of the time when you have a chronic infection, the most that will show on your blood test is you may have a lower white blood count, or it will be on the low side. So you actually could have an infection going on that your body is keeping somewhat under control. The other idea with it is dysbiosis, which is an imbalance in the bacteria. Epstein-Barr virus, which causes mononucleosis, the kissing disease, the wonderful thing, most of us have it in our bodies. And we probably live in a symbiotic relationship with it. So if you have an active issue with it, that's a different story, and it might be just an imbalance with it. Candida, another one that is actually inside our body. It causes yeast infections, thrush, and a bunch of other things. It's inside our bodies. It's meant to be there. It helps us. Some other ones that have been posed, well, some that are Streptococcus, which is strep throat, Staphylococcus aureus, which staph infections. Those 2 live in us. They actually have a place on our skin and inside our throat. They live with us. But our chronic exposure to Germ-X and antibacterial soap and all sorts of other antibiotics is creating a massive imbalance, as well as pesticides and everything else that you're taking. Glyphosate, if you're eating non-organic food that has Roundup in it, it's also an antibiotic, so it's going to be killing these things. So it's just another factor that we got to look at. One of the things, of course, that we're known for is Lyme disease and helping people with that. Heavy metals, you can get these all over the place, whether it's in your water, if you live in an old house, maybe you got lead, copper from copper pipes. Some other ones, aluminum is in our cookware. It's in the air we breathe because they spray it in the air, depending on where you live.
Why do they spray it?
Why do they spray it? So in California and a few other places, they're spraying it to help with climate change.
Really?
Yeah. So
And that's copper.
aluminum.
Aluminum.
Yeah.
Oh my God.
Copper would be slightly better. Aluminum's a lot more neurotoxic. So that's a little bit there. Mercury, of course, you can get that in a couple places. Living next to a coal plant is an easy one to get it. You could just be in your food and your water,
Is
tuna.
aluminum really a problem in this area?
Aluminum's a problem with a lot of your cooking ware. That would be one way. The other way is it's very high in vaccines. Not to get on a controversial topic, it is high
I
in
try
vaccines.
to avoid,
Deodorant.
I basically just use stainless steel and cast iron.
Yeah, that's what we use. Cast iron mainly. Then you have a weapon as well. Environmental toxins, we already mentioned a few, pesticides. There's other environmental toxins, of course, whatever comes from your carpet, if you have new carpet, the paraffin and candles. There's all sorts of things that are surrounding us, things that you wouldn't think of right off the bat. Your mattress is laden with it. We live in a toxic world and it's fun.
Excuse me, can I ask a quick
Yep.
question? I was in California for 3 years not long ago, so I'm wondering, how do you know if the area you were in, if it was being sprayed there? I mean, is there a way you can kind of like test the air?
Government websites might have it. That's where I read about it.
Uh-huh.
So in New York, I think, and Los Angeles County, I think I remember reading about their spraying in the air, the chemical.
I guess, I think we're all exposed to that, but we can do the hair testing to see the toxic metal levels.
If your
in
body is
us.
clearing it.
Right.
That's the other hard part is hair analysis won't show if your body's clearing it. Especially aluminum and mercury, which likes to hang out in your brain and not be cleared out of your body. So you could actually be high in mercury and aluminum and you don't know about it from those tests.
Well, and if you're eating at a restaurant, who knows what they use to cook, what kind of cookware they use.
The cookware, yeah, absolutely. The best thing you can do with that is,
Oh, it helps.
I don't like to get so paranoid about any of that type of stuff. I like what Chris Kresser, if anyone follows Chris Kresser, I like what he says. He either says 80-20 or 90-10. 90 or 80% of the time, be good.
Mhm.
And then the other 10 to 20% of the time, enjoy your life. Don't.
Don't worry about every little thing.
Yeah, because some of
Go
these
crazy.
guys that I follow with the natural health world, I'm just like, you guys are making people so paranoid
Yeah.
that they're not going to enjoy their life. And we live in America. It's not Europe where they banned some of this stuff. You're going to be exposed. The best thing is, how can we decrease the amount of level of this exposure and help support you? Maybe it's, you're going to go out to eat with family and you just need to take an herb to support you during that time. Something like that is what we usually recommend. We want you to enjoy your life. I want to enjoy my life. And
You
so
don't
we
want us
just
to
figured.
obsess.
Yes.
100% of the time.
Because then we're going to go into that last one, which is stress. If you're obsessed, you're now in the final category, adding to your trauma and your stress and everything else in your life.
But that is so absolutely true. That's like a big thing I hit on with clients because it took me a couple years in practice to like see that, to realize that again, that like the fear component that can often come from, it's not just medicine as well as holistic fields, both of us do it or can do it. It too can create this stress in people's lives and people get so concerned about some of those minute things.
To the
So-
point that they have an eating disorder.
Good point.
I just had never thought about it before, like what kind of cookware
Oh,
your
yeah.
restaurants